So what are the treatment options for patients with cirrhosis of liver? Before I begin this, I should let you know what exactly is happening when you are diagnosed with cirrhosis of liver. When you are diagnosed with a condition called as cirrhosis of liver, your liver is already scarred and fibrosed and hard, and almost 80% of the liver function, for all practical purposes, it's lost. So now, very important for us to know why it has happened. What is the etiology of a liver disease called cirrhosis of liver? In India, we know alcohol being first and foremost cause of liver cirrhosis. Almost 40-45% of the patients with cirrhosis have alcohol as a reason. So alcohol abuse, heavy chronic alcohol consumption is something which is actually one of the important cause of cirrhosis of liver. Other causes are hepatitis B and hepatitis C. Hepatitis C, almost 5-10% of the patients may develop a cirrhosis liver. Hepatitis B is up to 15-20% of the hepatitis B patients can develop liver cirrhosis. We also know the rise in metabolic associated steatotic liver disease or fatty liver disease. Up to 15-20% of the patients in India now are suffering with cirrhosis of liver because of MASLD, and this is a silent epidemic. Almost 1/3 of the general population who are walking on the streets are suffering from a disease called as fatty liver disease or MASLD, and which eventually lead to liver cancer. Now, having said so, there are many other reasons for patients to have a cirrhosis of liver. Now, cirrhosis of liver can also be caused by obstruction to the veins, and that is one of the commonest causes, Budd-Chiari syndrome. We call it as hepatic venous outflow obstruction. Now, what's important in this case is that when you have an hepatic venous outflow obstruction or Budd-Chiari syndrome, and if you pick this diagnosis early, you can definitely reverse it. So there are two types of Budd-Chiari syndrome. One is an acute Budd-Chiari syndrome where medical treatment will completely reverse the disease, whereas the chronic Budd-Chiari syndrome also progress can be halted by doing an interventional radiological procedure called as hepatic venous stenting or portovenous stenting. Another cause of cirrhosis of liver is autoimmune liver disease, a very silent liver disease which is prevalent in female population as compared to male, and usually missed because there is an overlap of alcohol in many of the patients. So as I said before, that alcoholic liver disease is common in men than women, but with rising urbanization, we are now seeing a rising trend of female patients also coming with the alcohol related liver disease. When it comes to autoimmune liver disease and a cirrhosis of liver, we see more common in female patient as compared to male, and there are genetic risk factors with which the patient are at risk of developing autoimmune related liver disease. What's more important for an autoimmune related cirrhosis of liver is that there is a definite treatment for patient with autoimmune liver disease, and the further progress can be definitely halted. How can you halt the progress of a liver disease in an autoimmune etiology or autoimmune liver disease is by giving a wonder drug called as steroids. And we have seen many patients who are put on steroids or immunomodulators, autoimmune related liver disease or cirrhosis, we are in a position to halt the further progress of that liver disease. One more factor which is very important, and one more etiological factor rather, which can cause liver disease is Wilson's disease, copper overload in layman words. So when there is a metabolic defect, copper metabolism defect, then it can lead to excessive accumulation of copper in the body. Most important site is liver, the other common site is brain, and most of the patients with Wilson disease present early in their childhood because of the genetic predominance it has, and they present with different features of cirrhosis of liver. So as mentioned earlier, they can present with common symptoms of cirrhosis like distension of abdomen, loss of appetite, then yellowish discoloration of eyes, there can be swelling over the feet, there can be usually liver abnormal movements, or they can have a brain involvement in terms of tremors or loss of memory or some kind of abnormal movement. So when the patient have cirrhosis of liver because of copper metabolic defect, we can halt the prognosis, or we can reverse to some extent the advancement of a liver disease by giving chelatic agents. Again, one more reason for cirrhosis of liver is iron metabolic defect. whenever people come to us with the diagnosis of cirrhosis of liver, we always make sure that we check their serum iron, transferrin and ferritin, because these are the subgroup of patients where iron metabolism related liver disease called as hemochromatosis can be a reason for their development of cirrhosis of liver. And giving iron chelating agent can help in further progress of the liver disease to that extent that we can halt the further complications of a cirrhosis of liver. So as I mentioned earlier, it is not just about diagnosis cirrhosis. It is very important for us to know why the patient has developed cirrhosis when there are no obvious causes for a cirrhosis of liver. As we mentioned earlier in my talk, I spoke about alcohol, obesity, diabetes, fatty liver disease, hepatitis B, hepatitis C, HIV. These are routine causes which every one of us knows that these are the common causes of cirrhosis of liver. But there are few silent causes which are usually missed, which are like I mentioned, autoimmune related diseases, copper metabolic defect, iron metabolic defect, patients on long-term antibiotics, patient with toxins and metals consumption, patient with alternative medication intake. They are all at risk of developing some kind of liver disease and ultimately leading to cirrhosis of liver. So when it comes to the treatment of liver disease called cirrhosis of liver, the first step is to know the reason for its development of a liver disease. The moment you know the reason for the development of liver disease, your 50% of the work is done, because then you can prognosticate the patient, you can also guide the patient, you can also prevent some complication. For example, a patient who has hepatitis B or hepatitis C, nowadays so many medications are available which are directly acting medication, we call it as, and those directly acting nucleotides or directly acting medications can help you in getting rid of further progress of the liver disease. Now, when patient has a hepatitis B related cirrhosis of liver, those who have a high viral load, a very high viral load can make them prone for development of the liver cancer. That's the reason we insist on bringing the viral load below detectable limit by giving antivirals, and then thereby further progression of the liver cancer can be halted. Now, when it comes to the treatment of cirrhosis of liver patient, the most important thing a doctor would tell you is that you have to have a medication for stopping the further progress of the disease by giving you antifibrotic medication like ursodeoxycholic acid, or we have to ask patient to consume 3 or 4 cups of coffee because that helps in antifibrinogen action. It can halt the further fibrogenesis in the liver. So that's why we recommend to have 2 to 3 cups of coffee at least per day. We also see the patients with cirrhosis of liver with different complications with which they come, like swelling over the feet. Then we give them diuretics. We also give them medication for further worsening of their disease called as portal hypertension, wherein we decrease the portal hypertension by giving them a beta blocker, which is selective beta blocker, which decreases the portal pressure and thereby decreasing the risk of gastrointestinal bleeding like hematemesis and melena. Patients with cirrhosis of liver are also prescribed laxatives and gut-specific antibiotic like dufalac and rifaximin for prevention of constipation and ultimately liver encephalopathy. And these are very standard drugs which is routine prescription in any patient with cirrhosis of liver. You would see 4 drugs are always given. One is ursodeoxycholic acid. If they have a fluid in the abdomen or on the legs, a diuretic is added. Then they will have a dufalac or a laxative and a rifaximin and a beta blocker for reducing the portal pressure and also further worsening of the liver disease called as carvedilol. So this is routine drug. This is routine treatment for a patient with cirrhosis of liver. There are newer drugs which have come specifically for metabolic steatotic associated liver disease like resmetirom. Now this is a wonder drug because patient with advanced fibrosis, this drug has shown that it can reverse the fibrosis, and there are many trials, many studies have shown that resmetirom with 80 microgram for 3 to 6 months can halt the further progress of the liver disease. Patient with steatosis or a fatty liver disease, we give saroglitazar or many other options are there, but saroglitazar being commonly used, I mentioned it. it can also, to a major extent, can reverse the further progress of the disease and can reverse the disease. Now, lifestyle disease, steatotic liver disease is a lifestyle disease. So, daily exercise, low fat diet, control of sugar, and avoiding of deep fried items, then avoiding of alternative medications, and we can say that daily workouts or at least 10 to 15 minutes a day would be very helpful.